What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. It's my first time using these, so bear with me if I'm distracted. For those listening in, I have a new pair of headphones, a headset. So we'll see how that works out for me. Today's topic is understanding the link, how sleep apnea impacts our heart health. So I wanted to touch upon the connection between sleep apnea and cardiovascular health, right? So we've talked about this in previous episodes, how prevalent sleep apnea is, not just in adults, but in children as well. And what is sleep apnea? It is that disorder where a person stops breathing for 10 seconds or longer multiple times throughout the night. And this interruption in breathing during sleep leads to a host of healthcare issues. We know it impacts millions of people worldwide, men, women, children. It no longer is the condition that affects the adult overweight male, right? That's what we thought it was as we were getting into this field. But we now know that it impacts everybody, but also how huge of an impact it has on our cardiovascular health. So some of the common side effects, for lack of a better word, are daytime fatigue, that constant feeling of tiredness no matter how many hours you sleep. Cognitive impairment is a huge one. And of course, we also know the connection, the impact that it has on our heart, be it cardiovascular disease, putting the patient at a higher risk for stroke, for hypertension, cardiac enlargement, basically just anything that can impact the function and the health of the heart. So what I want to touch upon briefly on today's episode is how this happens, and more importantly, what can we do to kind of work around this? So down to the nitty-gritties, what is sleep apnea? We just touched upon that. When a person stops breathing for 10 seconds or longer multiple times throughout the night. And there are many basic forms. The three main forms of sleep apnea are obstructive sleep apnea, which is what I mainly will touch upon today. We have central sleep apnea, that is where there's a lack of a response from the respiratory center in the brain. And then the third is complex. So obstructive sleep apnea is the most common type of sleep apnea. And this happens when there is an obstruction that causes the airway to collapse, basically, be it the tongue falling back, be it enlarged tonsils, the tissue, just anatomy, causes that airway to become blocked or obstructed. And this then leads to either a complete stoppage of breathing, which we know is an apnea, or a partial stoppage of breathing, or very shallow breathing, which is known as an hypopnea. And then central sleep apnea, as I mentioned earlier, is less common, but it's when the brain does not send a message to the respiratory center in the brain for that person to start breathing. So when an obstructive event happens, say the tongue falls back and has obstructed the throat, at some point, there's going to be enough of an oxygen deficit that the brain's going to tell the heart, wake up. I need more oxygen, and now. And that's when the heart is going to speed up and it's going to pump all that oxygen to the brain. Let's connect this. And I'm going to have these little connection aha moments throughout this episode as we go. Is this the person waking up with a racing heartbeat? Do you know anybody that's complained of this? Or are you one that has experienced this? When you just wake yourself up in the middle of the night and your heart is pounding, ask, is this what might have happened? So that was obstructive sleep apnea. Then we have central sleep apnea. This is when the stoppage of breathing happens, but the brain does not have that capability to send out that message to the heart that says, wake up, dude, I need more oxygen. And basically there's that lack of a response from the respiratory center in the brain. Okay. And then the third is complex sleep apnea. And this is also known as treatment emergent central sleep apnea. This is a combination of obstructive as well as central sleep apnea, also known as mixed apneas. And the hallmark of all of these different types of sleep apneas is that there is stoppage of breathing during sleep. This person, or as I say, patient, stops breathing during sleep multiple times throughout the night. There is a drop in blood oxygen levels. There is sleep fragmentation, which means there isn't continuous healthy sleep. And this then leads to a host of issues. This is the patient with daytime drowsiness. This is a patient that's falling asleep or the person that's falling asleep at the wheel. For those of us, if you're a dentist that's listening to this is our patient that falls asleep in the chair while we're working on them. And as much as I want to say that it's because dental appointments are so relaxing, you and I both know that's far from the truth for most people that walk into the dental office. What's important is the long-term health effects that happen because of this condition, and that is much worse. The implications of this is what should have us questioning and asking and worrying about what can we do to make sure this doesn't become a problem. So how does sleep apnea impact the cardiovascular system? We know that because of that stoppage in breathing, there is a disruption in the normal physiological processes during sleep. There is a dip in blood oxygen levels, the increased heart rate, the sleep arousals, right? Your body waking itself up, because that's the one job the brain has, right? Is to keep us alive and safe. And all of this leads to or triggers certain physiological responses. It basically puts us into a sympathetic overdrive. It has our sympathetic nervous system, which is our fight or flight response, right? Which is what I want to kick in if I have a bear chasing me, but not at night when I'm sleeping. At night, we want the parasympathetic nervous system to be in overdrive. That's a rest and digest. I want it to take over. But when we have these constant stoppages of breathing, you can go into sympathetic overdrive. The sympathetic nervous system is on alert. And when this happens, stress hormones are released in the body. Cortisol is our stress hormone. So these are patients that have high cortisol levels. Cortisol has an inverse relationship to melatonin, which is our sleep hormone, which is why if you're extremely stressed out, you aren't going to sleep. And this is why. So it has what I call a cascade, a waterfall effect. You also, adrenaline levels are high. And all of this just keeps the body in a perpetual state of readiness. Not what we're looking for when we're trying to sleep and we're trying to rest, relax, have the body heal and repair and rejuvenate itself, right? Now, these decreased oxygen levels that can happen because of the apneas can also trigger the release of inflammatory markers. These inflammatory markers can cause fatty deposits in our blood vessels. This is called as plaque, right? The plaque that accumulates in the walls of the arteries. In turn, all of this leads to high blood pressure, irregular heart rate, inflammation, AFib, atrial fibrillation. All of this increases the risk of hypertension, coronary artery disease, higher risk for heart attack, higher risk for heart failure. And it's just that waterfall effect that trickles down from what is happening when this person is stopping breathing and we have those oxygen deficits happening. Also, what's important to note is that the cyclical nature of sleep apnea, you're falling asleep and then your body's waking itself up. You're falling asleep and you wake up because you stop breathing, or your brain says you can't, you need to get it together. This disrupts our normal sleep and wake cycle. It disrupts what that normal rhythm should look like, and this can now upset hormone regulation, including the hormones that regulate hunger and satiety, leptin and ghrelin. Leptin is our satiety hormone, ghrelin is our hunger hormone. And what happens when these go out of whack? Well, I'm hungry all the time, right? This is when you tend to overeat. This is when your body doesn't know when to say, I've had enough. So now we are at a potential risk for weight gain and obesity. Now we're in this cycle where that weight gain and obesity is contributing to metabolic imbalances, is contributing to increased load on the heart. So how should we treat sleep apnea and reduce that risk of cardiovascular diseases? Key thing is the screening, making sure if you are a patient, it doesn't matter what healthcare provider you're seeing. It could be your dentist, it could be your MD, it could be a cardiologist. You could have just gone in for your annual physical. Make sure you have these conversations. If you wake up with this, don't question, well, what's my dentist going to do about it? If that provider isn't able to or doesn't have the answers, they will find you a provider. They will guide you down the path to, hey, go see a cardiologist or go talk to your MD about this, or let me make sure this is addressed. So always make sure you have these conversations. The more information we have, the better we're able to serve and guide you into what it is that might be beneficial. And for providers, the screening part, right? Asking questions, understanding the correlationship between sleep apnea and or untreated sleep apnea and all of the effects it has on the body and how that impacts the work that we do for our patients. Now, we know the CPAP is the gold standard to manage sleep apnea. However, the truth is a lot of patients are unable to tolerate it, choose not to use it, cannot use it, or just simply want alternatives. And that's where oral appliances come in, right? For a lot of patients, that is a more comfortable treatment option. And what is this? It's a custom appliance in the mouth that is made to fit you, your bite, what is going on with your sleep, and that is worn at nighttime. And what this does is it holds that lower jaw forward. It repositions, it keeps it out of the way, prevents the tongue from falling back, prevents the jaw from falling back, puts tension on the musculature in the back of your throat. The muscles are tighter. They hold everything much more upright and supported. That is to start with. Then there's other factors that also help, right? Lifestyle modifications, making sure you're going to bed on time and waking up, you have a routine in place. Don't pull all-nighters. Don't make it a way of life. If that is a habit that you have, work towards starting to getting into a more structured sleep pattern. Weight management is a huge one. Working with a dietitian, making sure you're getting exercise. It could be starting with walks every day. Again, please make sure you're connecting with your MDs, your providers, your primary care physicians to make sure you come up with a plan that is right for you. Make sure you're working with your sleep MDs, ENTs, whoever it is that you're seeing to come up with a treatment plan for this going forward. Regular exercise, very important. Avoiding alcohol and sedatives is important as well until all of this is sorted out and figured out. Sleeping position. I had an episode on sleeping position, which got some really good feedback, and I would encourage you to go back and listen to it. But does sleeping on the side make more sense for you versus sleeping on your back? So it's important to understand that this is a multidisciplinary approach. There is no one size fits all. There is no one targeted dart that I can throw at this condition and say, this is going to fix it. It usually has to be customized for each patient, what is going on, how old that person is. Is it a child? Treatment's going to look different. Or is it an adult in what their clinical situation is? So it has to be customized to what's going on. But the key is greater awareness, making sure we're talking about this, collaborative care, making sure you have the right team around you, be it your sleep MD, your physician, if it's a child, pediatrician, ENT, your dentist, maybe a myofunctional therapist, if that's what you need, making sure we have that team around this person that needs the help and works in a collaborative fashion that's going to help reduce this risk of unwanted episodes or events happening because of untreated sleep apnea. I hope this helps. If you know somebody that could benefit from this information, send them the link. As always, leave us a review, and I will see you next time.